Okay, so hello guys. I will be taking few radiology images here. So okay. So see this one, right? See this image. So this one is your puff of smoke appearance seen in Moya Moya. It has been asked Moya Moya disease, right? This puff of smoke. It goes in like this, like this, like this. Okay, I will remove this. So this is puff of smoke appearance, right? Puff of smoke appearance in Moya Moya, correct? See this puff of smoke in Moya Moya. Now here I was talking about the dense MCA sign. Once again, yes, this is the dense MCA sign. Can you see that? This is the middle cerebral artery. This one, right? Okay. Talking about this one. This one is your empty delta sign. You know, empty delta sign. This one, empty delta sign, CVT, right? Seen in CVT. I mentioned in my previous slide, right? This is the empty delta sign, CVT. Correct. Okay. So let's go to the next image. All right. So okay, see this one. See, this looks like eye of tiger, correct? Eye of tiger. See, so this is seen in Hellerbarden Spars disease. Hellerbarden Spars disease, correct? Hellerbarden Spars disease. All right. Just now look. This is this one. Figure of 8 appearance. Where it is seen? Figure of 8 appearance. Pituitary macroadenoma. Good. Pituitary macroadenoma. Now see this. This is ivory vertebra. Okay. Okay. This is not so important. Okay, so let me take another image. This is a picture frame vertebra. Picture frame vertebra means this is a vertebra and surrounding it, you know, shows something like this. See, this one and this one. This is a picture frame vertebra in Paget's. Other things seen in Paget's are, yes, good, Demoshunter skull and cotton wool skull. Yes, nice. And grass shaped, this one, yes, grass shaped shovels also seen, right? So anyway, so many things in pediatrics. I will discuss that in orthopedics, right? Okay. So see this one. This one is actually not a characteristic image that we will get in exams. Anyway, this is, don't follow this one. One second. See this one. See this vertebra, something like this. The vertebrae upper and lower end are little curved, right? So this is actually seen in it is also called as codfish vertebra, seen in osteoporosis. This is very important topic, guys. I will take it in orthopedics. Osteoporosis, T score is very important. T score is less than minus 2.5. If it less than minus 1, it is osteopenia. Okay. In osteoporosis, T score less than minus 2.5 and all lab values normal. All lab values normal. Okay. And see the vertebra, this, right? So this is, that's why it's called codfish vertebra or fish mouth vertebra. Chalo, next. Okay, telephone handle deformity. Okay, this is not asked, guys, so not that important. Okay, so this one I was talking about, important slide. This one, in a child with suprasellar calcification is craniopharyngioma, correct? Child with suprasellar calcification is craniopharyngioma, correct? Don't miss this. This is very important. note it down, right? Okay, now let's see this one. Yes, this one I was talking about. This one is chordate nucleus. This one is lentiform nucleus. Here it is thalamus, right? These are the ventricles, and this is your internal capsule, right? I mentioned it in the previous slide, right? You can easily know this one. And back. Yeah, see, chordate nucleus, thalamus, lentiform nucleus. Here is globus pallidus putamen. So anything even here, any hemorrhage, it is actually putamen bleed or hypertensive bleed, correct? Chalo. Yes, so this one I was talking about medulloblastoma with a dural tail. I briefly described it in my previous slide. And in medulloblastoma, since it is a small cell tumor, you will get this one rosettes. Rosettes actually, rosettes is many tumor cells arranged like this, and if there is a, if there is a blood vessel within it, it is called pseudo rosette. This one is a rosette pattern, correct? Seen in medulloblastoma, this type of rosettes, right? This one is SDH, subdural hematoma, correct? And cortical bridging veins is damaged here or involved in the this bleed, correct? And let's check out next one. This concave pattern, right? So SDH, see, bridging veins, right? In shaken baby syndrome or like that, right? Okay, so we'll take again next picture. Okay, this one we discussed already. Let's take this one. One second, guys. I should take another page. Yes. So yes, this I was talking about the cardiac anomalies. This is figure of 8 shaped. So this snowman's heart, right? Snowman's heart. This is your boot shaped heart. See, this apex is due to RVH in phallostatalogy, correct? And then we'll go next. This is this one is, see, this one Shepherd Crook deformity seen in fibrous dysplasia. This is also important, guys. See the pattern of this bone, crook type, right? Shepherd Crook deformity in fibrous dysplasia. Yes, so now we will discuss this one. This one is target sign, as I told, target sign in intersusception, correct? Target sign in intersusception. Now this one is, yes, this one is cobra head appearance. See this one, see this one. This is cobra head appearance in ureterosil. Ureterosil I discussed in the last slide, correct? If you remember. And this one is also I discussed in the last slide. See, this one is the MCU, mid-cutis hysterogram, and we are seeing this as PUV in the males, posterior urethral valve in males, right? Posterior urethral valve in males, MCU. In RGU, we would have seen the bladder. Here, bladder is not clearly visualized, so it is MCU, correct? So differentiate it from the RGU. Yes, this one we will also discuss. So see, this is the apple core deformity, right? This one this colonic cancer, apple core deformity or colonic cancer. We'll go to the next slide. See this one is bird's beak appearance, achalasia cardia. If it will be like that irregular, then it will be rat tail deformity in case of esophageal cancer. See, this one is coffee bean sign. I discussed it. It is for sigmoid volvulus. Correct? Sigmoid volvulus. Correct. Okay. Okay. So we discussed these topics. Yes, this one. See, guys, this is Wimberger's sign, right? This one. This seen in scurvy. It's very painful joint condition, right? Scurvy. Now, okay. Let's see rickets. We see this fraying cupping of metaphysis, and often the both the radiologies are nearby same of scurvy and ricket, but scurvy is a painful condition, ricket is not a painful condition. Mainly scorbutic rosary are painful, but ricketic rosary not painful, correct? And scurvy you can easily diagnose. This will be Wimberger sign, then there will be Pelkan spurs, I will show you, then pencil tape epiphysis, right? This type of epiphysis, when you will see, is definitely scurvy, no doubt about that. So you'll not be left with that confused, right? See, now water lily sign. Okay, this is your water lily sign seen in hydrated cyst. Okay, okay. Yes, so this one, see, this is your ankylosing spondylosis, right? This has been asked, very important. Is a young male with low back ache, ankylosing spondylosis, and HLA-B27 positive, right? HLA-B27 positive. See, there are some signs like this is interspinous ligament, this is paraspinous ligament. So when one ligament is involved, see, it is see, first of all, there are osteophytes, right? So we can see this as bamboo spine appearance. And when these ligaments are involved, is called paraspinous involvement, interspinous ligament involvement, what they say is as trolley track sign or dagger sign. So these signs are important. Trolley track sign, dagger sign, these signs are very important, correct? And the main how will you identify the scenario will be a young man with low backache on continuous sitting or like that of an HLA-B27 positive, maybe there, right? So next, I'll take a new page. Okay, so let's zoom it. Yes, so yes, that's what I am talking about in my last slide. This is your ascending aorta, this is your descending aorta, and this is your pulmonary artery. Can you visualize this, guys? One second, I will take the image again. It's very important image, so don't miss it. See, this is your ascending aorta, this is your descending aorta, this is your pulmonary artery, this is your spine or vertebra, whatever you say. And see, this is the thrombus, this is the thrombus. So it is actually pulmonary thromboembolism, correct? No doubt about that, right? See, ascending aorta, descending aorta, pulmonary thromboembolism. Chalo. Okay, so this one is the infarct, which I discussed in my last slide, that there will be loss of gray white distribution, the infarct of wedge shaped infarct with a mass effect. This is that infarct, wedge shaped, right? I showed you in the last slide as well. And yeah, and the ventricles are also dilated, as you can see. All the topics has been discussed already, nothing new. Yes, this is schwannoma, guys. Schwannoma is a very important topic and has been repeated so many times. See, this is this area is hypercellular, is Antony A. This is the hypocellular area is Antony B, and the in between bodies, these are verrucai bodies. You understand this one? This is the hypercellular areas, Antony A. This is Antony A. This is the hypocellular Antony B, and in between this space, no, this is verrucai bodies. Okay. Now this one is also important. This one, see, lens shaped EDH, and the artery involved, middle meningeal artery. You can see lucid interval, although you can see lucid interval in SDH also, but EDH is more, EDH is more associated with lucid interval. What is lucid interval? 2 period of consciousness in between a period of unconsciousness. Okay, conscious, unconscious, then again conscious. Okay, is there any slide left? No. Okay. Okay, let's take another. Okay, so this one is SDH. This we have discussed, right? This one is subdural hematoma, correct? SDH. And concave pattern bleed, as you know, as you are seeing, concave pattern bleed and cortical bridging veins involved. So, and how will be SH? SH will be like this pattern, and it is mainly traumatic. If non-traumatic, aneurysm rupture. Okay, and there will be cruciating, throbbing headache. So anyway, I have discussed some IBQs. If you feel interested, you can drop it the comment box if you want to see some more image based questions. I think I've taken almost major chunk of the radiology in your revision section only. If you revise it 2 or 3 times, you will identify the pictures. You will not feel any difficulty. If you want to see some more pictures, you can drop it the comment box, right? Thank you. Bye.